O'clock on a beautiful Friday afternoon. And this is the time that we get together to make sure that we remember that while we have been at this a long time, while we are in the midst of a health crisis, we know that we're going to get through this, and we're going to get through this together. So say it with me. We are going to get through this. We're going to get through this together. And one last time, we're going to get through this. We're going to get through this together. We're going to get through this together because we are going to be strong. We're going to be resilient because we have a good plan. And because we have done such a good job to date at protecting one another, at adjusting to something very different. And if we can do what we've done this last month and a half plus, I know we can do what it takes to gradually and safely reopen our economy while making sure we remain safe during this coronavirus pandemic. And we're going to get through this because we are going to continue to follow the 10 steps that it takes to defeat this coronavirus. Healthy at home. Tomorrow is going to be even nicer than today. And I want you to get outside, get some exercise. It helps us with our physical and mental and emotional health. But we can't get together yet. Remember, we got a schedule where in May, we're going to start having limited opportunities to do that. I want to get there just as much as you do. But if we stop being healthy at home right now, we potentially delay and frustrate our abilities to hit that schedule that we have in May. So let's make sure that we continue to get it done. Avoid crowds and gatherings. Again, beautiful Saturday. Going to be hard to do. Practice social distancing. That's when you run across people. Knowing when to seek care. kycovid19.ky.gov. Very important because this is where we're also going to have guidance on healthy at work. Washing your hands and surfaces, again, even more important as our contacts are going to increase. Applying for benefits. All right, so each day I'm trying to provide an update on claims, unemployment claims from March. 3,075 additional claims from March were resolved since yesterday. That means that they have a remaining 24,840 left. 8,000 of those are simply awaiting identity verification. An email has gone out to those folks. Let's make sure that we get those documents back to our unemployment folks so that we can take care of you. I know that they are working hard, but I know many of you are still waiting. We want to make sure that you are helped. We'll make sure that you get all of those dollars backdated. We got to get everybody through this because we're in this together. We're going to come out of this together. We're going to rebuild together. If we can flatten the curve here like we have done, if we can defeat a once in 100-year worldwide health pandemic, we can do all the rest of this. I know we can. Prioritize your mental health. So tomorrow, we're going to take a day off from my very first day off from this briefing. I need to prioritize my mental health, if not just for a day, and I know that you need to too. So let's take one day where while we follow all the rules tomorrow, let's not try to check in for an update. We're not going to have one. Let's not get online and read about this epidemic. Let's just take a day to breathe and to get outside, do some things that you enjoy doing that still fall inside these guidelines. Let's get refreshed. And on Sunday, we'll get back together again. I'll give you an update on both of those days, and we will move forward. But take a day that you need. And I'm gonna try to model the advice that I've been given, and I'm gonna take a day that admittedly I need pretty badly. Also report non-compliance. So today, this weekend, would normally be a really special weekend in the Commonwealth of Kentucky. Tomorrow would have been the Kentucky Derby. Today, though, would have been Oaks. And Oaks is special for a lot of reasons. It's not just the fillies that run in the Oaks race, though that is one of my favorite races. It's also turned into one of the most important days in the entire year for breast cancer awareness. And I know we've got a couple photos. Oaks Day is a day where they do a survivors parade, where those that have battled and overcome or are still dealing with breast cancer get a very special honor where the twin spires light up pink. It's a cause important to so many, including my family. My mom helped start Horses for Hope, Horses in Hope, which is a charity that helps out especially workers on the backside. Today is a day where I know many of these folks that would have been participating in the Survivors Parade are watching, and I wanted to make sure that today I honored them like I would on any Friday before Derby by wearing a little bit of pink. We still have other challenges other than this coronavirus out there, and we're going to be ready to address each and every one of them to protect our people, not just during this time, but going forward. We ask people to follow those 10 steps plus one additional. Fill out your census. And I got great news. We're up to 13th place, the highest that we have been since we have started this. It means that you are getting online and filling out your census. And I'm really excited because yesterday we were tied with a whole bunch of states at 16th, and it meant more of you got online to move us up. So I'm excited about being in 13th, but none of us are satisfied, I hope, being in 13th. We're looking at a future where every federal dollar is going to be absolutely critical, probably more so than at any time in my lifetime. Everybody that signs up, everybody that fills out their census, it'll take 2 minutes at most, will help us in the rebuilding effort. So if you haven't done it, get online, fill out that census. Let's continue to move up from 13th place. All right, every day we also ask people to model the type of behavior that we need to see, healthy at home, about showing their compassion and their kindness. And we ask you to use these hashtags so that other people who maybe just need a little lift during the day can put in these searches and can find those great things that other people are doing around Kentucky. So here's a little bit of what we have today. All right, so with Derby coming up, everybody is looking for a couple things that they can do to celebrate, especially in being healthy at home and finding what our teachers and our students can do to make it special this year. All right, so we're asking people, strongly recommending, but again, no one's going to be penalized, when you go out in public to wear a mask. So when we start moving into healthy at work, your contacts, everybody's contacts, are going to go up, which means the chances that you have it and are asymptomatic are going to go way up. And I know personally for me, I don't want to be the reason that someone vulnerable or who might react badly to the coronavirus, we can all react that way or have a serious health impact. I don't want that on me. I want to make sure I've done everything I can to protect my fellow human being, and I want to make sure I do everything to protect my kids. And for both of those reasons, I'm going to be wearing this, and I hope you will too, because at the end of the day, we might not like it. We might say nobody should be able to force me to wear a mask, and we're strongly recommending it. But shouldn't we want to do just this one thing to protect our fellow human being? If the commandment is love thy neighbor as thyself, then don't we want to make sure that we are taking this step to where if we are asymptomatic and we would cough or otherwise sneeze, it stays with us and doesn't impact other people? I'm going to do this because I know it's the right thing to do, and this is the right thing to do too. People making masks to make sure that they're out there and that other people have them, and every day I see more and more. So let's keep it up. Remember, we don't want that second bump from the Philadelphia versus St. Louis slide. We want to make sure when we reopen our economy, it stays open. Let's look at the next. All right. This is a book drop, trying to make sure that we especially our kids have that type of material that is out there to stay intellectually challenged, to make sure that we are intellectually healthy. The steps that people have taken to help one another, to help our students, they've been real special. That's the Callaway County Library. All right, this is Advent Health in Manchester. Again, our frontline heroes showing up to help those in their community here in Clay County. All right, this is another one of our recovered Kentuckians. And I love the shirt. I punched COVID-19 in the face. And you know, I love that feeling that he's got. Every time we have somebody that gets better, it is reason to celebrate. And here's the Twin Spires, where people would have flocked to all this week and been there tomorrow. And while today would have been pink for the Oaks, it is green for compassion for everybody in Kentucky we've lost, for everybody that is struggling, but also the color of renewal, knowing that there is a better day ahead and that those we've lost are headed to a better place. And here we got a short video too. You know, it is Derby, and typically we're thinking about horses and jockeys as kind of heroes, or those that we would turn the spotlight on today and tomorrow. This year, spotlight's going to be on the place that it needs to be.
It's not the race they expected to run. It's not the hat they thought they'd wear. But when the bugle sounded, they answered the call to post. And when they hit the final stretch, they will lead Kentucky to the winner's circle once again. So weep no more, because the sun still shines bright on my old Kentucky home, because of heroes who have been and always will be right here.
We appreciate St. E's in Northern Kentucky helping to put that together and honoring those that are working so hard this weekend and have worked hard every weekend to make sure that we are safe and that we do everything we can for those who are struggling with COVID-19. All right, so every day we have also tried to make sure that everyone can be included, not just in these updates, but that we learn to include those around us on an everyday basis. And so Virginia has been teaching us a little bit of sign language each day. And with tomorrow looking like it's going to be such a nice day, wanting everybody to have that mental health day, we thought we would learn, enjoy your day. Right, enjoy your day. Right, enjoy your day. Thank you. And each day we'll learn a little bit more, and especially how so many of our kids have reacted in not only getting to see sign language during the entire briefings, but also to learn a little bit. It's been really special to see that reaction and that spirit of wanting to be able to communicate and include everybody. All right. Testing updates for today. We have finished up now our first week in Louisville. As of 4 o'clock today, we had 227 that had come through, meaning we've tested at least 1,457 in that Louisville Kroger location. And the Louisville Lexington location, 1,612. Bowling Green, 1,125. Owensboro, 934. We know we'll have some additional today in 3 of those sites, but just from the Kroger partnership this week, we know we've done over 5,128 tests. Now that shows how significantly we are ramping up our capacity. Walgreens in Lexington, we just got some totals as well. This week, they have done at least 848 tests in that one location. But let me briefly mention, especially yesterday, we're having no-shows at some of our Kroger locations. It is really important that we use every one of these tests. So if you sign up, please make sure you go and get tested. Between the 4 locations, Bowling Green, Louisville, Lexington, and Owensboro, I think we had just under 400 no-shows. Now, we were able to fill some of those, but remember, there's not enough testing nationwide. We're ramping up ours, to get it in the place that we need to, but every test is so important. It can teach us so much, and it can make sure that you are safe and healthy. So let's make sure that when we sign up, we go through and we use that test. Testing next week. There are still spots in the Kroger locations. Lexington, Louisville, Ashland, and Bowling Green all still have at least some spots. They are filling up. What you do is you can go to our website, but you go online to the Kroger portal to make sure you sign up. It'll be later in the week, but there are just a few spots left, and we want to make sure that we get you in. Remember, we also have numerous other testing locations. This week, we got up to about 14 of them. We're going to have a number next week, too. We're working with more local health departments to serve their needs if they have an ability to conduct one of these. And we see some others that are able to get their own kits and run them, like Hazard, which is doing such a good job that they are opening now for more days. So, Hazard, which is a primary care center, teams with a lab called Solaris, and on some days they're doing 130, 140 or more there at that facility. Christian County Health Department put this together, are doing a great job. I think they're doing about 60 a day, but every day serving that community. Mount Vernon through their hospital and others. We want to keep growing this. And what we want to see is we want to see some of our other partnerships continue to grow. Those partnerships with Walgreens and Walmart have also been so important. So remember, we are taking our testing and we are scaling up significantly. What we're doing week by week right now compared to 1 month ago is the difference between night and day. And we want to make sure we continue to scale it up. And we think we can get close to 30,000 tests a week, which would be a good place for us to be in to make sure that we are helping those that are symptomatic, that we are protecting our first responders and our healthcare workers, that we are testing the general public, which gives us data on folks that are asymptomatic, and that we also have a connection to employers as they come back online for Healthy at Work. Make sure that we have some robust testing out there that we continue to grow. Remember, it is a challenge in Kentucky. Your state government is doing a very large percentage of this testing. Some other areas, there are larger private providers. In the end, it's my obligation it's my job to help us get through. I'm going to do as much of it and at whatever percentage we have to make sure we can protect one another to get through this. Healthy at Work, very quickly. Remember, we put up a schedule on how we are going to be doing this. And I know that state to state, it is a little bit different, but everybody is taking a gradual, phased-in approach. In part, it's based on how they have seen the spread and how they assess the risks. So for these May 11th areas or industries that are going to be opening up, we will have the specific guidance for them. That's in addition to the 10 rules up on the website on Monday. It's pretty final. Much of it's already gone through the industry groups, though we're going to be sending it back. So that'll be more than a week full notice to have those up, to be able to see them, and to be ready. Let's go to May the 20th. Wanted to mention that, again, retail at some capacity and houses of worship. Wanted to talk briefly about that because we have a number of houses of worship that might not be ready or might want to wait a little longer than May the 20th. And that's actually a promising sign if someone says, we want to do this the right way and we want to take our time to get there. So please listen to your faith leaders. If they are running your church or your synagogue or your mosque, they know what it takes to run it, and they know what it takes to get it to the place where it is ready to go with the cleaning that's going to be required, which is significantly more intensive than we'd otherwise be doing, and really thinking it through. You can't have a choir right together. You got to space family units out. You got to really think about every part of that service, let me say that we are getting great proposals in from our faith community and from all parts of our faith community. We want to do this right, and doing it right for many of our houses of worship might be doing it later than that. Just because you can doesn't mean you should, and please trust that faith leader if they say it's going to take just a little bit longer. And then finally, we have the 25th, where we're able to do even 10-person social gatherings. Now, I know there are those that wanted to be in phase one that aren't, and in other states they may be, but it's our job through public health, through the governor's office, through the Cabinet for Health and Family Services to make the best decisions that we can. And we're starting to see some numbers from Georgia that may suggest their decisions were wrong. We don't know yet until we see them. But 1,000 new cases overnight, I certainly want to see where that's going to go and what it means. And we can compare that to the decisions they made. Because we don't want to be the first to do this. We want to be the smartest and the best. It gives us an opportunity to get that real data and to make sure we're not putting anybody in a situation that is dangerous for them. So we hope that phase two will begin in June and can include significantly more activities, ones that we've just got to figure out how to do the right way. I want to go over our top 10 rules for healthy at work. Just make sure that these become as normal to us as our top 10 rules for defeating the coronavirus. Continue telework. If folks are being productive through telework, they should stay doing telework. We've actually found in parts of some of our largest cabinets in state government that we have better productivity in some areas. We're not going to reverse course and bring people back into a building just to bring them back into a building if they have been successful in telework. Phased return to work. And just because you might be the 11th doesn't mean everybody shows up on the 11th. On-site temperature or health checks, masking. So employers and employees, it's required there because you are going to be around more people. This is the way that we protect each other. That's a little different than if you're just going out in public. If you're just going out in public, you're going to a grocery store, you should want to do this to protect the other people around you. Closing common areas, enforcing social distancing. This means in a workplace, we need to be walking around at times and making sure that people are actually keeping that distance. Sanitizer, special accommodation. So in phase one especially, if you are in that 65 and up, heart, lung, kidney disease, you need to still be healthy at home and nowhere but healthy at home. So your employers need to make sure they're working with you. And then you will need to have a connection and a testing plan for what happens when someone shows up who is sick. Tracing. We'll have a graphic on tracing here Sunday or Monday, but we are putting out this afternoon our request for proposal for assistance in creating one of the levels of tracing. It's going to be about 500 people that can help us in contact tracing and can assist our local health departments that do a great job, but assist them virtually. This is something we have to do in this method because this is a 7-month plan. That's not permanent hires, and we want to be able to make sure that we can shift resources to a place that has an outbreak. Now, we're going to be hiring, or we're going to hope that the proposals come back, have people from all over the state because we got different areas in our state. And we want to make sure people are talking to people who sound like them and understand them. And so it's going to be a work in progress, but this is the way, getting this out, getting the responses back, choosing a good partner that we're going to be ready for our tracing in time to make sure we can truly be healthy at work. Wanted to share a pretty neat story today, and it was about an adoption in the midst of this coronavirus. It was actually adoption by Zoom. I feel like we advertise for Zoom in the way that we talk about it. But in the midst of this difficult time, there are some truly heartwarming stories we got to celebrate. We got to grab those really amazing moments. Trish Galbraith writes, Caleb took our hearts on February 9th, 2018, and more than 2 years later on Wednesday, she wrote, he finally took our last name. It was not what they had expected, but Trish and Gary Galbraith adopted Caleb in Kenton County on Wednesday. We've been waiting so long and just wanted it to be official that we were willing for it to be just by Zoom, and so many people worked together to make it so special, Trish wrote. Trish and Gary have been married for 27 years. Seems like everybody we talk about has had a really long marriage. So Trish and Gary, congratulations. They have 3 biological children and a foster child. They've been fostering since 2015, and Caleb was the first child they tried to adopt. Oh, this kid has been through so much and is still a beautiful, giving person. I'm so grateful for all of those who made it so special for him. Trish, his mother, wrote, "Congrats to Caleb. Congrats to the Galbraith family. And thank you for opening your hearts and your home for a child who needed it. And thanks to all our social workers, organizations, to the court system that was able to make this happen. Everybody who worked tirelessly to help make this happen." Pretty neat. In a time of social distancing, a child got to find his forever home. Congratulations to everybody involved. All right. Our numbers today for our report continue to hold steady around what we are seeing, showing that we are, if you look at just numbers of cases on average, say over 3 days or even day to day, at about a plateau. And that is the case even though we are testing more people than we ever have. And it's the case even though we're now going into areas like long-term care facilities, Green River, where we expect to see a number of cases and where social distancing is more and more difficult. So this plateau is still good news. We still have a ways to go to defeat this virus. But the fact that you, Kentucky, have not only flattened a curve, you cut the top off the muffin, you have truly saved so many lives. Keep it up. Your work continues to be excellent, and it is protecting people. So our total number of new cases today is 177. When we remove duplicates, people from out of state, our total number of cases, 4,879. One of those is a probable. The rest are lab confirmed. That's out of a total number of tests of 57,648. Again, these numbers are going to go up and up and up as we've tested more this week than any other week, and that continues to be the case. Total number of Kentuckians ever hospitalized, 1,411. Currently hospitalized, 334. Ever in the ICU, 652. Currently in the ICU, 178. This has been going up. We want to make sure that we continue to think about those in intensive care. And the number recovered, which is up a decent amount from yesterday, 1,752, including our friend who punched COVID in the face that we got to see today. New cases by county, 41 in Jefferson, 25 in Butler, 13 in Warren, 11 in Kenton, 6 in Boone, Davis, Fayette, and Graves, 5 in Hopkins, 4 in Grayson, Hardin, and Henderson, 3 in Campbell, Christian, McCracken, Oldham, and Pike, 2 in Bracken, Bullitt, and Muhlenberg, and 1 in Allen, Ballard, Floyd, Hart, Jessamine, Johnson, Livingston, Logan, Madison, Marion, McLean, Montgomery, Nelson, Perry, and Simpson. And tonight, we've lost 8 more Kentuckians to this virus. 8 Kentuckians that have left us before they should. 8 Kentuckians who are going to be missed by their families, who are loved by their communities, and for whom we need to make sure, even though we have lit up our houses night in and night out, that we continue to do so. Because these families are going to need it tonight and tomorrow night, to know that they're not alone and to know how much we all care. So let's do that. Let's buy some more. If you don't have one up, come on, let's continue to add them out there, so that if anybody in any of these families tonight needs to get out and is taking a drive, taking a walk in their neighborhoods, that they see more green lights than they ever have before. That's not going to it's not going to stop the grief, but I'd like to think that it can help just a little. Of these 8, they include a 90-year-old female from Graves County, an 86-year-old female from Marshall County, an 80-year-old female from Butler County, a 93-year-old male from Carlisle County, an 81-year-old female from Jefferson, a 42-year-old male from Jefferson. So I'm 42, so when we think that this only hits certain folks that are out there, let's remember we all have to do our part. 67-year-old female in Jackson, and a 58-year-old female in Adair, who is a second staffer in a long-term care facility that we have lost. So let's think about all of these individuals who are more than an age and gender and a county, and to make sure that we do remember how real it is. We have an opportunity each night to honor an individual or remember an individual that we've lost. Tonight, it's Jerry Thompson. So tonight, we want to honor an incredible Kentuckian we lost to COVID-19 on Wednesday. Her name was Audrey Geraldine Jerry Thompson. She was only 71 years old. She retired from Jefferson County Public Schools as a teacher assistant after 20 years of service. She was the aunt of one of the assistant principals in Jefferson County, Susan Webb. Susan said Jerry was a remarkable woman and loved by people across the Commonwealth. Her children and grandchildren were her life. She never met a stranger and would go out of her way to do anything for anyone. According to her family, Jerry was a friend to everyone. Anyone who knew Jerry would agree she was an exceptionally kind, deeply compassionate, and full of life. Her smile would light up a room. She was always there to lend a helping hand, a good meal, or give words of wisdom. She was devoted to her family and loved them deeply. Everything she did for them. To her children, grandchildren, sisters, nieces, nephews, and friends, we're thinking about you and your families as we mourn this loss. Team Kentucky, this is why we got to keep up the fight. Remember, all of these families would ask that not only do you show your compassion to Green Lights and others, but that you make sure you're following the healthy at home rules so that other folks don't have to lose someone so special. Looking at the ethnicity and race data, which we do every day, of total cases, 74.97% white, 13.37% Black or African American, 6.3% Asian, 5.19% multiracial, and of total cases, it's really right at 90% non-Hispanic and 10% Hispanic. Deaths, of the known cases, 79.43% white, 17.7% Black or African American, 2% Asian, 1% multiracial, and then the breakdown on ethnicity is 98.5% non-Hispanic and 1.5% Hispanic. Quick update on Green River, state-run prison facility where we had an outbreak of this virus. The mass testing is now complete, which means we have tested, I believe, every inmate that was willing to be tested and every individual that works at that facility. Over 350 were tested today. Over the last 3 days, 1,200 COVID tests were administered to the entire prison. We'll be getting these results back in this next week. It's through the Gravity Partnership. We'll process those. It will help us to do everything we can in that facility. Long-term care facilities. Again, a difficult area that this virus impacts significantly. Our update today is a little better than some, but it's hard each and every day. 25 additional residents, 4 additional staff, and 6 additional deaths, which include 1 staff death. So in everything we do, we have to make sure that we do everything we can to keep this virus from getting in these facilities. So as we look at being healthy at work, and we have to make some tough decisions about how we can do that, some things that we can't do. When we look at not having public pools open in May or in June, and probably not after that, it's because every one of those contacts that's shared can then go back to other people and potentially get to one of these facilities. It's probably not, if you're in one of those situations, you or the person that you, if you're asymptomatic, may spread it to, that are going to be harmed. It's how it continues to be spread and ultimately can harm someone in a vulnerable position. All right, with that, I know it's a beautiful Friday. We're going to get right to questions, and I'm going to see if this time we can wrap up in or even under the hour. So I have some written questions, and then we've got Ben Tobin. Welcome, Karen Czar, Mike Valenti, and Phil Pendleton, who today isn't sitting outside, but is back in here with us. So, Phil, why don't you kick us off?
I know you promised about unemployment, and there's still an awful lot of claims out there. We're still getting a lot of people.
Mm-hmm.
Can you talk about what the delay has been, what the problem has been in getting all those completed by the end of today?
Right.
Or by the end of this week?
So we started at the beginning of the week or at the end of last week with about 130,000 March claims that we needed to get through. And we've now done, ballpark 105 plus thousand of those have been processed and the dollars are out. So now we're past any glitch in a system. Now we're past any problem with the overall volume. Now we are to claims that we've got to fix something in. And there's a number of reasons that can be. So about 8,000 of them we ought to be able to resolve because they're identity verification. In other words, we still need a couple of documents, and an email went out to help on that. And so I hope we can get those 8,000 people off. Now the remaining, under 20, I think it's 19 to 20,000, there are some real legitimate issues that we have to work through, and we would have to, whether or not we were in COVID-19 or not. Someone may have checked a box that under the law means that they can't get benefits, but they may not have known the situation, and we want to work with them to potentially change that. In other words, if they mark that they quit. Now, it may have been that things were shutting down, that they had to do it because they're in a vulnerable population. Those are different boxes that people have to check, but you got to get that fixed. And then there are some employers that are challenging these, and at any time you've got to go through those. So I believe what we have been able to do is to get through every part of the March claims that were on the state's end from a processing standpoint, and not from a substantive issue that we have to address for people to get those dollars under the law. Now we're going to continue, though, to prioritize those folks and to work through them while we're also doing April's claims. With increasing cases in meatpacking facilities, has the governor considered stepping in to recommend or force a brief shutdown of operations? Our chief of staff from the Department of Public Health has been working on this today and in many days. And I believe we've had two providers, JBS in Louisville and Tyson in Henderson, that have agreed to do a temporary shutdown, go through with cleaning, working well with some of our folks. I will say that Purdue has not been as helpful and as responsive, but we are going to continue to try to work with them to get the right things done. We can't ask people to walk into a very dangerous situation if we and an employer aren't doing everything they can to make it safe. So we're going to continue to take steps, and we'll do what it takes to make sure that we can make those facilities as safe as we can. I continue to believe that if you have to shut down for 3 days, but it means that you can create a safer, healthier environment, that may keep you from having to shut down for multiple weeks or even a month. So I hope those that need to hear that. All right. Yeah, Ben, right?
Okay. What impact would the revenue projected revenue shortfall have on the Pike State government if there were no federal aid?
So the question is, what would the projected shortfall, what would its impact be if we had no federal aid? So in the current fiscal year, the numbers could be, close up to about 500 million. I think the current estimate tops out about 490, 497. That would be significant. It would mean, and that's just in the executive branch budget. Then we have the transportation cabinet budget, which is more severe by a percentage, less by an overall dollar. So if there's no infrastructure bill on that side, there's not going to be any new work done, certainly for the rest of the fiscal year. There'll be some continuation, but there'll be less going on out there, so there's less jobs that are out there. On the executive branch side, it'll require some significant cuts by the end of the year. I don't believe in this fiscal year we'd have to do layoffs, but we certainly wouldn't be doing any hiring, and we would cut all non-essential spending. It's a real challenge, and what it would do is it would take us into the next year in a precarious situation. And the next fiscal year, some might not understand that we run government from July 1 to June 30th. And so that next fiscal year is the one that it would be disastrous. We would have to look at every single one of our programs that are out there. We'd have to look at basic staffing in areas that it's so essential. Education would be, which receives so much of our funds. It threatens them. It is so severe that the federal government has to step in and do something. It would be just as impactful in the Great Recession. And on top of the Great Recession and what we were looking at about jobs, on top of that, we have everything it takes to defeat COVID-19. And we're having to spend, we have a lot of federal dollars for it, but we're having to move more and more people to address this pandemic, which means there are fewer to do important other jobs in state government. Ultimately, if the federal government doesn't help, this recession will be longer, deeper, and more painful. It'll probably be more painful on those that are most vulnerable, because that's where government services go, and everybody will feel the brunt. Everybody from our kids and services we're able to provide them to our seniors and services we'll be able to provide them. Ultimately, our government is supposed to be by, and I hope for the people, and the people are definitely going to need this type of state and local government assistance. Otherwise, we're not just going to hurt. We're going to be in a bigger world of hurt. All right. This is from Joe Ragusa, who we don't have today. What are my thoughts on the protest plan this weekend at the Capitol with the limitations put in place because of the coronavirus? I hope that any demonstration is just done safely. Every decision I've made hadn't been political. It hadn't been anything. It hadn't even meant to be controversial. All of it has been based on advice from experts in public health to save lives. And with the UK study, we know we've saved thousands of lives. Now, I hope we made all the right decisions. We probably made a couple wrong decisions, but they've all been aimed at helping people. So if you disagree with it, just disagree with it in a way that isn't going to hurt you, isn't going to put your health at risk, and ultimately, knowing you could be asymptomatic, don't do it in a way that gets you around a whole lot of people, and you could get the virus and spread it to someone that chooses not to be at one of those demonstrations. So just try to do it safely. Karen.
Kind of piggybacking on Phil Rowler with unemployment.
Yes.
Same thing. We were getting messages, people afraid it's the end of the week. Our biggest concern, and you already covered it, or their biggest, is they need more information. Many of them have said can't find the information that's needed. Their employer has even tried to verify it for them. Do they have any other options?
So on the verification, the identity, an email went out to the 8,000 from March that we believe that we still need, that unemployment still believes it needs verification from. It listed each of the types of verification. We can get you a copy of that. I think they've already got 1,000 responses back. But if you're in that area, we want to make sure we can help you as quickly as possible. And we can if we get the verification, provided that you don't have another issue, that it's not verification plus employers protesting it. How many patients were tested for COVID-19 at Western State Hospital? Is the hospital still not accepting new patients? And what is the patient census now? Today's patient census is 110. Approximately 21% of the patients have been tested. At this time, the facility is not accepting new admissions. Western State is working closely with the Department of Public Health, and we believe it is stabilized. We were very happy to see that. So that says that with the right intervention, doing everything that we can see an outbreak in a facility, and then ultimately stabilize it, which is what we believe has happened there. We want to make sure that we can do the very best, especially for those that may be confined in one situation.
So I know
Mike.
you don't want to get into a political back and forth on the federal aid, but Senator Mitch McConnell appears to be drawing a red line when it comes to liability protections for businesses. He says that it's absolutely essential to be included in the 5th installment of the CARES Act. What are your thoughts on that? There are some people that are concerned that if that does go through, it means that people will be forced to go to work in a dangerous environment.
The question is on the absolute need. I know I say it, it's just the absolute need for state and local government assistance from the federal government in a new CARES Act. Asking me to respond, I think, to Leader McConnell's statements that he would have to have certain liability protections from business to include that in the next package. I haven't seen what the details are in any of those liability packages or issues. I'd certainly hope that they would have to follow all the rules and the regulations that are out there, but I'd have to see what the details are to comment. I know DC seems to work on a negotiation and a horse trade. I don't work that way. And certainly in a time of a worldwide health pandemic, I don't work that way. I just know what we need. We got to ask for it. We got to push for it. I had a call with Senator McConnell, I think yesterday, where I talked about how much Kentucky needed this help and how badly we would be hurting without it. And he listened. At least he heard me out. Is Kentucky still coordinating its response with the group of states, Ohio, Indiana, Illinois, Michigan, Minnesota, Wisconsin? It seems like states are announcing pretty different reopening plans. So, yes, we are coordinating. We are talking, and our public health groups are talking too. I talked, I think this morning, it's either this morning or yesterday morning. Days kind of blend together sometime, with Governor DeWine and Governor Holcomb, who I also have a separate weekly or sometimes more conversation with. And what we do is we talk through all the challenges that we're seeing. And we talk through how we're doing things a little bit differently, and we try to understand how. But most of us understand, even if somebody's making a slightly different decision, we understand why we're making those decisions, doing the best we can to protect our people. And I will say, for all of these states, it is gradual, and everybody is watching to see what impact various openings have with the virus. Everybody is committed, to my knowledge, that if we see a spike, that we pull back, because we all want to make sure that we do it the right way. I would ask that if things in other states are open that aren't open in Kentucky, that we not travel to them. If we want to be healthy at work, right? If we want to do this, we got to make sure we get into the habit of following the same types of rules. So our healthy at work assumes that we can limit contacts in the beginning, in the rollout, to your home and your coworkers. But that becomes a bigger challenge if it's your home, your coworkers, and if another state has a restaurant open earlier than us or something else, it then becomes those contacts too. And so what it can do is it can harm our ability to gradually phase up and do this in a smart way. So I'd ask you, stick with us. We have a plan where you can see certain dates. We're going to work with other industries and associations to get dates up for them as well. We want to do this right. It's a matter and a difference of life and death. Phil?
About the houses of worship, when they actually start able to, on the 20th or the 25th, when they go back to services again, should they start with a limited number of people? Is there like a recommendation, like, okay, you need to start off with like 50 people?
Right.
or
So the
a
question,
certain number of people?
the question is on houses of worship and how it might look in limitations on capacity and numbers of people. We're actually working directly with a number of the different faith associations, organizations, conglomerations, denominations. There's a little bit of rhyming there, but working with them directly to come up with the nuance of the guidance. Yes, initially coming back, there's going to have to be a limitation on the number of people. They're going to have to be, no matter what that number could be for a facility, they have to be able to socially distance family groups. You're going to have to make sure that you can do the cleaning. You're going to have to think really carefully, if you're in my faith, about how you do communion so that you don't have people coming into too close a contact or touching. And starting off with the service, but knowing that there are other things that often, on Sunday, we would go to a service and then our kids would go to Sunday school. And then we would do other things at the church, youth choir and the like, that it's got to be gradually and phased in. What I would say is everything we've been receiving back from all of these groups wants to find a really safe, gradual way to do this. I think the Baptist Convention put something up online and sent it to us where they are thinking through this very carefully. So we've had a really good response that gives me a lot of confidence that we can do it right. But I want to make sure that they have the opportunity to weigh in before we simply set a number. But yes, it's going to have to be fewer people. We have to do everything we can to keep those over 65 with heart, lung, and kidney disease watching at home. And there may be some, and I know there are going to be some, that are going to wait longer, that aren't going to go on that date because they're not ready, or they look at their church and they think too much of the population falls in that danger area. There may be some who continue to do the drive-in services because they can have more people that could potentially come, and we want to have all that flexibility. But we are working to get back to an in-person service experience, but one that is done safely. Do I see a similar path in Kentucky I think similar to what Indiana put out today? I think Indiana also has a gradual return to work. Now, they put out more phases, but they didn't put dates on all of those phases, or they're all contingent on different things. We put out phase 1. We're working on phase 2. So I think that there will be certainly some similarities, and that we're going to try to learn from each other. We've even talked about that. What is our first decision on this or that industry have? We can share that with them. What does their first decision on something different have? And they can share with us. What is my message for Kentuckians planning to cross the river to dine in at Indiana restaurants? We're asking you, stay healthy at home. We can see how that works in Indiana. We can learn from it, and if that means moving up our timetable or moving back our timetable. But doing that can frustrate the plan that we have and could potentially push back our timeline to getting back to healthy at work. Because if we do certain things that cause a spike in cases, then we have to pause everything. So remember, our ability to keep this curve plateaued and on the decrease ultimately, we have to make sure that we're taking actions to ensure that happens.
When do you plan to appoint a new member to the Board of Education?
When do I plan on appointing a new member to the Board of Education? Well, this is one I want to get right. And so we've been thinking through different options. I don't have a set timetable for it. And admittedly, while I've had a couple conversations about it, I've been a little busy with the virus. But we want to make sure that we get a good representative that's on that. I will say that David Karam, who wasn't confirmed, has been a hero for the education community. He has been a leader in so many areas. I appreciate his service, especially in this time that he served as chair. He is also a friend of mine, and I know that we will be able to find some other areas, hopefully education-related areas, where he can contribute. Karen?
Since we haven't overwhelmed the healthcare system, what is the plan as of now for field hospitals? How do you see that operation going?
Question is, since the healthcare, we haven't overwhelmed the healthcare system, what's our plan on field hospitals? Well, our plan for the one we control, which is at the fairgrounds, is we are going to keep everything in place, and we are going to have it, while not staffed on a daily basis, ready to go at any time that we need it. So again, we're trying to see what's happening in Georgia. It might just be a one-day thing, but 1,000 new cases overnight. That would mean that if we make a wrong decision and we see a spike of cases, we might need it. The other thing that we might need it for at any given time is one of these acute care facilities, the long-term care facilities. And if we had a one where they couldn't do a COVID wing and we had really sick people really fast, it gives us another option. One more?
Yeah, the FDA has given emergency use authorization to the antiviral drug remdesivir. I think President Trump reported will be used to treat advanced cases, hospitalized patients.
Right.
There are about 178 people, I think you said, in the ICU in Kentucky. First, what are your thoughts on remdesivir? Do you think it's a promising treatment? And how do you go about fast-tracking that to be used in hospitals?
So the question is on a drug that has been that is very promising in its ability to help. Right now, I think they're saying very sick folks with COVID-19, and this is one where it's promising now. We've seen just a lot of information out there on things that may or may not work. I put my faith in those areas in Dr. Stephen Stack, who couldn't be here today. We take his guidance. He has a weekly call with our hospital systems. I'm a governor that's gonna leave the actual provision of health care to those health experts, which is guidance from Dr. Stack, but ultimately is that doctor that is there with that patient, knowing their specific circumstances. But listen, that news is pretty good. News that they think that they're at least promise to a potential vaccine in January. That's good news. Lord, I hope that is going to happen. All right, so today I'm going to get to end you with something pretty special. So Derby time is a time where we don't just have the race, but all of Kentucky comes together. We have special events. Our schools all across Kentucky get to participate in different ways. So it was probably about 5 days ago that somebody reached out to us and said they wanted to bring together 13 colleges and universities that would have been at different places during this week to perform My Old Kentucky Home. And I'm excited that we were able to make it happen. Now, this video was made for tomorrow, but we wanted a chance to share it today. We'll see you Sunday at 5. Enjoy tomorrow. Turn everything off for a little while. Invest in your mental and emotional health. I'm going to do it too. Thank y'all. Hey everybody, it's Governor Andy Beshear, and it's the first Saturday in May. That's typically a time where hundreds of thousands of people come together, but we know during COVID-19 that we can't be doing that. But this year, we have found new ways to make sure that we connect with one another and that we are able to celebrate the good work of all Kentuckians in flattening the curve and in saving lives and making sure that we still honor this day and have a chance to enjoy it just a little bit. So at a time where we can't be physically together, 13 colleges and universities have shown us a way to be more unified, even on this day, than I think we've ever been. So they're coming together virtually to play My Old Kentucky Home. I'm proud of them. I'm proud of you.
University of Louisville Cardinal Marching Band would like to thank these schools for participating. And this is Steve Kirkland, the voice of the Cardinal Marching Band, reminding you it's great to be Team Kentucky. May the sun always shine bright in our old Kentucky home.